Okay, everyone, good afternoon. Welcome back. It's 2:30 and I believe that we should go ahead and get started. So, workshop one, I'd like to introduce you to Dr. Jenny Douglas, who is leading our first workshop on wellbeing. Dr. Jenny Douglas is a senior lecturer in health promotion at the Open University, and I have the privilege of working with her. And I don't mind saying that she keeps me sane. She really does. She is also an honorary member of the Faculty of Public Health and is a director of the UK Public Health Register. Dr. Douglas's research is vast and spans over 30 years, focusing on issues of race, health, gender, and ethnicity. The key theme unifying her research and activism is intersectionality, exploring how race, class, and gender affect particular aspects of African Caribbean women's health. I have the privilege of working with Dr. Douglas at the OU, and we have the privilege of her wisdom today. I present Dr. Jenny Douglas to you. Thanks, Jenny. Over to you.
Thank you very much, Marcia, and hello, everybody. That was a wonderful introduction. Thank you so much. And I will hopefully cover a fair amount of ground in 30 minutes. Okay. So I'm going to talk today about well-being, but I really want to say that you can't separate health from well-being, because, you know, for every kind of assault on our physical health, it affects our psychological and our mental health. And the reason that I want to focus on the health of Black academics is that for too long, the health of Black people has actually been ignored, and it's been invisibilized. And we have very limited data on the health of Black people. So generally speaking, we have very limited data, and we have very limited data that looks at the interaction of gender, race, ethnicity, and social class, that looks at intersectionality. And, you know, if we look at some of our current research around health and ethnicity, you know, it kind of falls into various kind of silos. We have health research that doesn't consider the intersection of race, gender, and ethnicity. We have research on poverty, and here in the UK, there's been a long tradition of research on poverty and material health and social class, but that doesn't consider ethnicity or gender. We also have research that's focused on ethnicity or gender, but actually doesn't look at the interaction and the intersection of gender and race. And then we have research on ethnicity and health, and that often is undertaken in a way where it doesn't consider a range of intersections. So we actually need to develop appropriate methodologies in order to look more comprehensively at health and well-being. Oh, sorry, I've kind of gone forward. Okay, so nobody's mentioned COVID today, so I'm sorry that I'm the first person to mention COVID. But, you know, even though we have known about the long-standing inequities in health that have been here really for the last 50 years or more, COVID has actually shone a light on those long-standing health inequities. And, you know, we can't think about COVID without thinking about Black Lives Matter. And when we think about Black and minority ethnic communities, although we only make up 14% of the population, we actually made up 34% of the critically ill COVID sufferers. And in relation to doctors, a large number of doctors who actually died were from Black and minority ethnic communities. So as we look at Black and minority ethnic academics and COVID, a greater percentage of of Black and minority ethnic communities have suffered from COVID. And now this is nothing to do with our ethnicity. It's to do with our exposure to COVID. It's to do with the way that we're actually treated in hospital. So we are at much greater risk of poor health in relation to COVID. And now we're at much greater risk, if we contract COVID, of having long COVID. And so even though many of us have been able to work from home, we're often, we have family and friends who are not working from home, who are frontline workers, who are working in health and social care or transport services. And, they are more likely to become ill from COVID. And, it's been very, very sad. I think that there are none of us who have not been touched by COVID in one way or another. That, we have lost many of our friends, relatives, and colleagues from COVID. And we've had very limited opportunities to actually celebrate the lives of those people that we have lost. And, we also have to think about the wider context that we as Black and minority ethnic academics are actually living through. It's not long since we saw people die in Grenfell Tower. The kind of impact of the Windrush betrayal affects us all, and police brutality affects us. Even though it may not affect us directly, the impact of the knowledge of police brutality affects us all. And of course, COVID, and as we've all heard today in terms of the experiences within higher education, COVID has actually also shone a light on racial inequalities in higher education. And, as Black and minority ethnic academics, we are experiencing racial inequalities in higher education. We experience racism in our day-to-day work within higher education. And the impact of COVID also has had an impact on higher education institutions. So there are many Black and minority ethnic academics who are on short-term, fractional contracts and also at greater risk of unemployment. As universities are coming to terms with the kind of financial pressures that have been caused by COVID, we've seen increasing redundancies and also reductions in people's working week, which then has an impact on their income, and this has an impact on their lives. In addition to that, what we've seen also is a call for proposals on the impact of COVID and its kind of effect on Black and minority ethnic communities. And what has been interesting is that many Black and brown people have applied for research funding, and very few Black and brown people have actually got research funding. So that, in the call that was put out by NIHR and UKRI, no Black PIs actually got funding. So that kind of demonstrates as well what we've heard all through today about the ways in which Black researchers are actually excluded from the research process. And we as Black researchers and early career researchers need to think about how we're going to build research capacity. Because we need to train the next generation of BME researchers to be able to lead on intersectional research. But as we heard from the Leading Roots research on the broken pipeline, very few Black people actually get studentships. And there are only 30 Black studentships awarded to people from a Black Caribbean background. So the obstacles that we need to overcome in building research capacity is, how do we get more research studentships? How do we get more research grants? There are not many Black and minority ethnic people who are actually members of research funding councils or advisory groups of journals. So Black and minority ethnic researchers need to be seen as scholars and recognised as legitimate producers of knowledge. So we have a lot of things that are actually going against us. And as we've heard earlier on today, we have a small percentage of Black professors and even fewer Black women professors. And of those Black women professors, very few are getting research funding. So I just wanted to set what I have to say against that backcloth. So yes, we are tired and we are weary, and we need to place priority on our own health and well-being. And it's really important that we think of the words of Audre Lorde, and that we remember that caring for myself is not self-indulgence. It is self-preservation, and that is an act of political warfare. And we actually really must care for ourselves. We must look at the things that sustain us. So let me ask the question to you all. How are all of you caring for yourselves? How are you ensuring that you sustain your health and well-being, not just for yourself, but for the work that you actually want to do in the future? And I think we must all think about how we put our own health and well-being first. And we must also make sure that we are not just supporting our families, but also our Black and minority ethnic colleagues. How often do you see Black and minority ethnic colleagues who you can see are not actually doing well? You know, we talked earlier on about the kind of the day-to-day racism that we all face. We might call it microaggressions, but it's drip, day-to-day racism. And work that Arlene Geronimus has done in the 1992 talked about weathering. And this day-to-day racism has an impact on both our physical and our mental health. And we must be very, very aware of it. So we need to look at ways in which we can nurture our souls and think about how we bring our values into our work as academics. You need to choose research areas that you are passionate about. And one of the things that I'm going to recommend, I haven't heard it mentioned actually. I've heard people talking about the importance of getting research fellowships. But the other thing that is really important is that sometimes you can get very short research fellowships for a month or 8 weeks. And I have been lucky to search them out and to get them. I've had 2 travel fellowships. One where I actually looked at health promotion in the Caribbean, in Jamaica, Trinidad and Barbados. And I had a travel fellowship to look at healthy cities in Toronto. And more recently, I had a National Centre for Research Methods Fellowship looking at intersectionality and developing intersectionality-informed research methodology, where I spent a month at George Washington University in Washington. And I have a visiting research fellowship, which I will be doing at Oxford, where I will actually spend some time focusing on a writing project. And what I want to say to you all is for you to look for these opportunities, because what they do is they actually allow you some time out. They allow you time to think about your own research priorities, to actually put things into context, and to start to build your own research. So I would very much recommend that. And looking through Twitter, somebody actually advertised a research fellowship that's coming up that is focused on BME early careers at Somerville College. And they're advertising 2 annual visiting scholarships. That's for 4 weeks with accommodation, all meals, and up to £2,000 to assist with travel and research costs. And the deadline is the 4th of August. So, you know, it's important that we actually start to look at things like that. Oh, sorry, I put that on top of my laptop. There we go. So, you know, that we start to look at things like that. I think it's also really important that we look for spaces like this, spaces where we can actually support and nurture other Black and minority ethnic staff, where we can actually share our experiences of racism and discrimination with other academics without having to explain or justify, you know, what that racism, how we experience that racism. You know, we need to be able to discuss different perspectives without negative feedback or being belittled. We need to acknowledge that, you know, we all have different perspectives and we all may experience racism in different ways because we are all coming from different social locations.